Western Cape has recorded well over 2,000 new COVID-19 cases, making it the second highest source of new cases after the country's epicenter, Gauteng. Meanwhile, vaccinations in rural parts of the province are lagging behind those in the metros, hence a 63% week-on-week increase compared to 44% in the metro. The HOD of the Department of Health in the Western Cape, Dr. Keith Cloete, joins me now to discuss this further. Very good evening to you, Dr. Cloete, and thank you so much for your time. So let's start with that difference in percentage, 63% week-on-week increase in rural areas. Of course, my colleague Ronald Masinda was having a chat with some farm workers there who have, of course, some, what do you call it, myths that they have about the vaccination and what the vaccine can do to your health. Is that the real issue? Is that the biggest issue that the Western Cape is finding, the ignorance, the misinformation about the vaccine?
Good evening, Morena, and good evening to the viewers. Yes, just put it in context. The 63 week-on-week % increase is increase in number of cases, as opposed to the 43% week-on-week increase in the metro. That's more a factor of, let's call it seroprevalence. And seroprevalence means the amount of antibodies people have following the second wave. We know that in terms of the second wave, we had a very high second wave in the Western Cape. And bigger pockets of the metro had higher infection rates in the second wave compared to the third wave. In the second wave, there were lower infections in some of our rural outlier areas. Therefore, the antibodies people had to protect them against the ravages of a third wave was less. So I think the impact of having less protection in the rural areas is the factor that we're seeing now with higher case increases in those areas. The fact that there is a hesitancy, a misinformation about what the vaccine represents is an additional factor, because what we're doing is, while we have this rate of infections, we're also trying to vaccinate people right across the province. So there has been a disparity in terms of access to vaccines in the metro area, and we're trying to increase that access in the rural areas. But now, having brought the access, is really the uptake in terms of this. So those two things are not necessarily linked, but they are, it's two different parts to the same problem that we're trying to address.
How much work is the department putting into making sure that this misinformation is corrected and that people in rural areas, people who don't have that kind of access to information that people in the metros would have, do get the right information? Are you guys going out there in your numbers to ensure that people do understand how the vaccine works?
Absolutely. And the best stories to counter misinformation is stories of people that's been vaccinated in those settings. So our communication team is doing localized stories of people that's been vaccinated in the context that people can identify with, and to hear the voices of people that have been vaccinated in those rural areas, to tell the story in their own words, and to convince the people that are skeptical in those settings that nothing wrong will happen to them, that all the myths is misplaced, and that the vaccines are there to protect themselves.
Keith, Gauteng is clocking numbers just under 13,000, at least in the last 24 hours. And of course, second to Gauteng as the epicenter of the country is the Western Cape. Is there a concern from the health department that these numbers in the Western Cape could get as high as what we're seeing in Gauteng?
Morena, at the moment, our context is that we're working on just over 2,000 reported over the last 24 hours. If you average that out over the last 7 days, it's about 1,500 cases. We know that on the South African COVID Modelling Consortium, their prediction is that we will go to about 3,000 cases per day next week. And over the next 2 weeks, we are looking at increases, but not quite to the same level as Gauteng. So what we're preparing for is, because of the Delta predominance, the Delta variant predominance that became very evident over the last weekend, that led to the level 4 adjusted lockdown. We are preparing for case numbers that will be equivalent to what we saw in the second wave, and we're preparing our health system response to be able to cope with what we had to cope with in December, and we're adding some additional capacity to be able to cope. So we are going to see increase in cases, but not to the same extent as happening in Gauteng.
And that is because you're confident that you're going to be ready to handle whatever it is that comes?
It's a combination of two things again. The first one is that we had quite a significant second wave. although the Delta is the predominant variant, there is protection, cross protection from having been infected previously predominantly by the Beta variant. And the fact is, because of that and the population size, we don't quite going to get to that level of cases. We have been in the second wave, as I said to you, right down this path. And our preparation is of such a nature that both the public sector and private sector hospital capacity is being geared towards what we expect to be the peak over the next few weeks.
Just before I let you go, Dr. Cloete, one of my colleagues, Monique Mortlock, she visited Kliprand the one time, and one of the concerns that she had mentioned that she had heard from the residents of that town was access to healthcare facilities, at least proper healthcare facilities, that the only access they have is to a satellite clinic that doesn't necessarily have the kind of capacity that a clinic would have. Is that something that is being dealt with in areas like Kliprand?
Just to put it in context, I visited Kliprand. Kliprand has got 200 people. 200, 300 people. Having a satellite clinic there is actually quite good access for the size of that community. And by being there and having that satellite service to serve the 200, 300 people is quite good. And we have people that also pick up people. There's a health net service that pick up people that needs to have access to services elsewhere. The challenge is when somebody has an emergency and they have to get transport from that to get to Vredendal. Vredendal is about 2 hours away by car through all those dirt roads, and to get an ambulance to pick somebody up is quite a challenge. But in terms of reach, that satellite service is there. Our team has gone out to people in Kliprand. They've been in isolation and quarantine, and actually the team has been back yesterday and the day before and starting to vaccinate the people over 60 there.
Dr. Cloete, thank you so much for your time here on Newsnight this evening. That is, of course, Dr. Keith Cloete, who is the HOD of the Department of Health in the Western Cape.